and get started. So welcome everybody. This is our June community meeting for opioid settlement funds, joined by colleagues from OMH and DOH. So I will ask them each to introduce themselves. Joanne?
Sure, thank you. Hi everyone, Joanne Warren, Deputy Commissioner for the Office of Health Equity and Human Rights with the Department of Health.
I'm Ben Rosen, Chief of Staff to the Executive Deputy Commissioner here at the Office of Mental Health.
So thanks for joining. And actually, Ben is a guest co-host today, sitting in for Chris Smith, who usually joins us. My name is Connie Burke. I'm the Associate Commissioner for Data Management Research and Planning here at OASAS, and happy to be holding these monthly forums that give us an opportunity to just check in to provide the community with updates around the OSF work that is underway, and then also to provide folks an opportunity to ask questions. As I understand it, we did not get any questions that came into the OSF project management mailbox this time around, so know that you can always enter your question in the chat now during the meeting, and we will be able to respond. Just a reminder to folks, the last advisory board meeting was in May. We have our next meeting coming up on July 10th. Information to be able to access that live stream is available or will be available through the OASAS Opioid Settlement Fund Advisory Board page on the OASAS website. So please avail yourself of that information. In terms of kind of just a quick update, I just want to remind folks that we do have the Opioid Settlement Fund Initiatives section on our webpage with information about the regional abatement, as well as initiatives that we have initiated using the Opioid Settlement Fund. So there's a host of information there. We also do list the recordings for previous meetings and the Q&A that is conducted during the course of these meetings is posted there. I do believe we still need to get last month's up. That's all on me, making sure that that's all set to go. So I take responsibility for the delay there. Just reminding folks in terms of our objectives, again, wanting to give you guys an update, a reminder that the principles of integration, equity, and, evaluating the work that we're doing are primary in the opioid settlement fund work. I had mentioned regional abatement already, so I just want to give a quick update there. We have received 75% of the regional abatement plans from entities, so that includes dollars that were allocated for each LGU in the counties, as well as dollars for the 5 large cities and the other litigating entities, so towns and villages that were specifically identified and in receipt of dollars through the regional abatement. In terms of recent announcements, we did just announce the Addictions Professional Scholarship Program. So know that we are making scholarships available to folks who are working in the OASAS, OMH, and DOH systems through programs at Alfred State College, Stony Brook, and also Empire State University. So information on those scholarship opportunities are available on our certification webpage, and there was also information that was sent out to our provider community. So if you have any difficulty locating that information, please do reach out to the OSF project management mailbox, and we'll make sure to send you the link. In addition, hopefully forthcoming in the next couple of weeks are announcements on some of the RFAs that we have currently active. So hopefully we'll have awards announced for the outreach and engagement, street outreach, and clinic model funding opportunities that we put forth. We currently have our Connections to Care and our Community Prevention Coalition RFAs that are active. So we're in a blackout period, so I can't say more other than the due dates. So the Connections to Care applications are due, or were due, I take that back. So the Connections to Care were due 5/22, so we're actually reviewing applications right now. And the Community Prevention Coalition RFA due date was the 16th. So those are in, and we're starting our process of reviewing and scoring. In terms of what's active and out there, so I'm correcting myself, the Youth Education and Engagement RFA, those applications are due July 20th. And for any of these initiatives, again, you can go to the Opioid Settlement Fund initiatives section of the OASAS webpage and get additional information. We have other RFAs that we expect to issue in the next couple of weeks, so stay tuned. Always keeping in mind that we're focusing on those 10 priority areas that were identified through the settlement and through the board. So happy to see Deb Davis also joined us. Deb, is there anything, let me just throw you in, Debbie, is there anything that you wanted to comment on with regard to the regional abatement or the RFAs that we've issued?
Yeah, unfortunately I went to a different link and went on a different WebEx. So I'm not quite sure. Did you cover, you know, the amount of payments? I don't know. But we're at 97% have paid for the abatement monies, which means 53 of the 55 local government units have submitted their planned use of funds request form and has been approved and received monies. And that's at a total of 54 million. And then all 5 of the large cities handed in their plan. They've been approved and they've received all of their money. So that totals 7.3 million. And then 8 of the 21 other litigating entities, which are named towns, cities, villages. So 8 of the 21 have received their funds because they have submitted their forms and everything's approved. And that's just over 700,000. So it's made great strides. Compliments to all of our local partners. We appreciate your help and look forward to answering any questions related to helping you get your plan of use funds in if you haven't already. And I think that's all that I have from a quick update.
All right, great, thank you. Yeah, so there are some entities that haven't responded and submitted that planned use of funds. So for those, I know there are a couple of counties and other litigating entities. So we will be doing some outreach to be sure that they have access to, they know the steps and they have access to those dollars. Other things, just want to say that our low threshold buprenorphine RFA, which was the first RFA that we were able to post, we are in the process of contracting and we're very excited to move that project forward. We do have dollars that were allocated through OSF for fentanyl and xylazine test strip purchase and distribution. So we're very excited to make those supplies available as well as naloxone available. So again, going to the OASAS website, if you go to our harm reduction section of our website, you'll get information on how to access those supplies. Having said that, Joanne, Ben, oh, sorry.
One thing just to add, I'm sorry. Just to say, you know, when Connie says we're going through contracting, I really just wanted to say what a Herculean feat it is, right? Because once you release an RFA, right, and you get through all the applicants and the scoring and do the awarding, then you have to get them all, make sure they're all processed in Grants Gateway and Charity's website and NSFS portal. And then we'd send that contract to the AG's office and then to the Office of the State Comptroller for approval. So we are actually all through all of those steps, except for the Office of the State Comptroller. For so many of our early RFAs, you know, that are not yet in contracts is just because we're waiting for approval from the Office of the State Comptroller. So a lot has moved. And just wanted to make sure that folks knew that just saying it's in contracting doesn't mean like it's been stagnant there. It's been moving through its process.
Right, and it's a long process. It takes some time. Thanks, Debbie, for that reminder. Joanne, I think you were about to say something.
No, actually, just going on earlier, I just wanted to really acknowledge for those providers that are on the line that are also doing work through funding of DOH, really to acknowledge all of the tremendous work that's being done. I know that it's been an interesting summer so far already, and the work really has been tremendous. So on our part, that's it, and really glad to see all that's moving.
Yeah, interesting summer so far, because it never ends, right? I think that we've kept up a pretty stiff pace regardless of the season, right? We just keep moving forward and moving along, and there is a lot of really great work that's being done. So happy to open it up to questions. Ben, certainly if you have anything to share or comment, you're welcome to. I realize in your guest host position that you know might be limited.
No, just here to listen and then respond to what I can and then take back what I can.
Okay, great. So do folks have questions? Anything that folks want to ask? I mean, please feel free to submit that in the chat. I do see there's a little bit of activity here. So there is a question that did come in actually to the mailbox this morning that asks if there have been any conversations regarding the existing recovery community centers across the state. Budgets haven't increased regardless of the increase in the number of people we serve, and I would also like to know if the opioid task force will create a pathway for recovery community centers to bill for peers, which is one way we can become sustainable. New York has already created a framework of centers across the state, the potential of which has not been tapped into. We've already begun to create a statewide infrastructure to offer wraparound services and connect people to harm reduction, treatment, and recovery. And that the person would like to submit the Rockefeller report as evidence of the effectiveness and potential across the state. So that's great. Certainly if you would like to see that information shared with the board, we can work to ensure that you have opportunity to share that information. We are currently working on developing initiatives based on the dollars that are allocated under recovery as one of the high priority areas. I don't have information specifically in terms of those initiatives as they are being developed. I do appreciate the fact that the recovery centers have, even outside of those that are state funded, there are some that are funded through, in the past, state opioid response dollars, and I think still supported through state opioid response dollars. So we absolutely recognize the value that they add and the services that those recovery centers are providing. I will ask our recovery bureau to add more to that when we post our questions and answers on the webpage. I don't believe we have anyone from recovery logged in right now to comment further. So thank you for that. Great question about regional abatement. So Melissa, were your ears ringing about, a half hour ago? Because I was actually meeting with our team here at OASAS to talk about the reporting requirements for the regional abatement funding. Know that we do have our monthly regional abatement meeting with LGUs and other litigating entities scheduled for Friday at 2 o'clock. We are going to talk about reporting for this year. Because the statute does specify that we need to collect reporting from entities by August 1st. So we have established a process. We're going to talk about it on Friday, recognizing and in keeping with what I've said to folks all along with regard to the regional abatement reporting, we are trying to keep it as straightforward as possible and realize that folks already have a lot on their plate. So we're going to talk about that on Friday. Other questions? No other questions. What else can we tell you? I know Melissa had asked specifically about regional abatement. So I do, just will comment to say that with regard to evaluating the use of opioid settlement funds more broadly, that OASAS is developing an evaluation plan. We do actually have a meeting coming up to talk with our partners at DOH about use of data and evaluation to better understand how these funds have impacted New Yorkers, and obviously too, given that the dollars will extend for another 16 years, we do want to have a plan in place to be able to monitor the spending and assess the impact of all of this funding. So that is something that we will be talking more about in the fall. Here's a great question. What new funding might be coming out? So I'm going to take the liberty of interpreting that two different ways. One, I will say that with regard to new funding, we do know that we will be getting information on 2024 appropriations in the near future. So that will certainly provide us opportunities in terms of adding dollars to the work that we're doing. So that's one way I'm interpreting your question. And then the other way is with regard to upcoming RFAs. So we do have a couple of RFAs that are in process right now. We are looking to issue a funding opportunity around transportation. And we also have dollars. One of the high priority areas is with regard to research. So we do have an RFP opportunity that relates to the research funding that is available. And I do hope to see those issued within the next couple of weeks. Beyond that, like I said, we are talking about utilization of the recovery funding as well as housing. So we have those upcoming as well. There's a question about the link for the Friday discussion on reporting, and I actually will have to ask Lucia if you could make that available in the chat, or is that information sent out? I think we also do a send to folks, to the counties on that, but.
Lucia put it in the chat also.
Awesome, okay.
Thank you.
Thank you. Let's see, will there be funding available for Recovery Housing Part 863 startups? That is a great question that I don't have an answer to right now. I do think information will be forthcoming on that topic. Another question, will there be further RFAs for mobile mat vans? And I'm not aware of anything currently. Again, we are operating and utilizing our funding, our appropriations from 2023. So this is just the beginning, and I can't foresee the future, but certainly that would be something that we would be looking at and considering. So the upcoming opportunities for RFAs, transportation and research. Research is the second RFA that I mentioned. All right. Questions, comments, certainly welcome comments from my co-hosts. I don't see any other questions in the chat. Now's your chance. All things opioid settlement fund. And a reminder for folks that the next board meeting is scheduled for July 10th, I believe 10 a.m. and it will be live streamed as the others have been. Ken asked about upcoming opportunities question. And I cannot provide any details on those two. That's the struggle, right? Because we want to ensure fairness and we're following the procurement rules, there's only so much we can say in advance of issuing an RFA, and certainly while the RFA is active, we are very limited. Actually, we're not supposed to talk about it, right, Debbie? So I don't have additional details except to say, please do keep your eye on the OASAS procurement webpage, or you can look to the OSF initiatives webpage for more information. We also do send out an all provider send when RFAs are posted, regardless of the funding source. So we try to get the word out in a couple of different ways. And again, with housing and recovery, those initiatives are in development, and I expect that we'll see funding opportunities in those areas probably later in July. Other questions? I'll just give it a minute. I wish I had an interesting or fun story to share in that minute while giving people a chance to think if there's any other questions that they want to ask. I appreciate the fact that folks have joined us for this conversation and just to hear any updates and certainly to hear each other's questions about the Opioid Settlement Fund work that is underway in the state. Okay. So no other questions have come in. Everybody gets an extra half hour back in their day. I won't tell anybody that this 1:30 to 2 slot is actually open on your calendars because I'm sure somebody would grab it for all of us. So thanks for joining. Good to check in with everybody. We'll expect you'll be tuned in on July 10th. And again, if any questions in the meantime, please don't hesitate to email the Opioid Settlement Fund OSF Project Management mailbox, and we'll talk to you very soon. Take care, everybody. Bye-bye.